The coronavirus is pushing many hospitals to their breaking point, and the vaccination effort is under pressure as well. People who wanted to get the vaccine lined up in Texas yesterday, and many counties there are now out of the vaccine. One hospital in Northern California had to move very fast to give out hundreds of doses that started thawing out after a power failure there. Our lead national correspondent, David Begnaud, is in Los Angeles, where the ambulances have been told not to transport the patients with virtually no chance of survival. Boy, David, I heard that and thought you would hate to be the patient that needs to get to the hospital and told, nope, we're not taking you. Good morning to you.
Think about that, Gail.
Yeah.
Good morning to you. That's what it's come to. They're now telling these ambulance drivers, don't even bring them. If they don't have a chance of survival, don't even transport them here. L.A. County is arguably the epicenter of the country when it comes to COVID, and Martin Luther King Jr. Community Hospital, where we are in South L.A., is the epicenter in the epicenter. Let me tell you this. They have 134 licensed beds. That's what they have approval for. You know how many COVID patients they have as of this morning? 164. Sean, take that live picture, if you will. We put a camera in the meditation room of the hospital this morning, with their permission, of course, because they have no space left. They're using this to treat people who don't even have COVID. They are out of room. They're using corners and the chapel and the gift shop and the meditation room because they are out of places to put patients, yet the ambulances keep showing up.
Look at the lines to get tested in California and to get vaccinated in Florida. These are pictures of a pandemic spiraling out of control in most corners of the country. There are more than 4 million seniors living in Florida, and they are overwhelming registration websites and hotlines in a rush to get immunized.
We were here 2.5 hours early because we figured there was going to be a showdown.
But the state of Florida has administered less than 25% of the doses it already received. Facing criticism for the slow pace, Governor Ron DeSantis issued this warning.
Hospitals that do not do a good job of getting the vaccine out will have their allocations transferred to hospitals that are doing a good job.
Giving half doses of the Moderna vaccine to those between the ages of 18 and 55. But new this morning, FDA Commissioner Stephen Hahn cautioned against that, writing in a statement suggesting changes to the FDA-authorized dosing is premature and not rooted solidly in the available science.
There's a fundamental concept here, take as directed.
That is Dr. Tom Frieden. He's the former director of the Centers for Disease Control and Prevention. He says the first way to speed up things is for the government to ship all available vaccines instead of holding half in a reserve for second dosing.
Let's get the vaccine out, get first doses into people as the second doses are coming along. That's not saying let's change the regimen.
Back here in Los Angeles County, where we are, one person dies from COVID every 15 minutes. Narissa Black is a nurse at Henry Mayo Hall Hospital in Valencia, where the number of COVID patients jumped from 15 at the end of October to nearly 100 today. She's worried about the quality of care as doctors and nurses are being forced to take on more patients.
This patient needs pain medication, this patient's oxygen level is dropping, and this other patient now needs to go to the bathroom. If you cut our time short, what will we need to cut short?
Let's talk about this new variant of the coronavirus. It's believed to be more contagious, but not more deadly. There are 6 variant cases here in California, 1 discovered as of yesterday in New York State. And Anthony, the variant first popped up in the UK, and as you know, they have now gone back into full lockdown in the United Kingdom.
Yep, at it again, David. Thank you.